now call upon Ms. Minh TRAN from Vietnam to speak on the status of vision impairment in Vietnam.
I think it's to say good morning, but good afternoon, everyone. It's been a wonderful, thank you so much to the organizing committee for the invitations. It's my pleasure to be here again. Why again? Because 12 years ago, I actually was in the first APAO of my entire life at that time. I was a baby at that time, I could say a baby optometrist who about to graduate from Bachelor School of Optometry, Viprasad. So it's my honor to get back here. Namaskaram, everyone. Yeah, so today, to continue with Professor Saw as well as Dr. James regarding about the screening and the status of visual impairment and refractive errors, I want to provide a little bit of the picture of Vietnam. So I have no conflict of interest, although I'm academic lead of one of the university in Vietnam, so we receive many sponsors and support from many other companies. However, regarding to this, we do not have any conflicts of interest. So I will go through in this talk a little bit about the Vietnam population so you understand a little bit about us, and then an overview about vision impairments and refractive error status in Vietnam at the moment, and then a little bit, a very small picture of the eye health screening that we are doing at the moment in Hanoi Medical University. So talking about Vietnam, Vietnam is a Southeast Asia country lying in the light, very small S letter over there. We have 101 million, with 40% of the population living in the urban areas. So we share the feeling of Dr. James and of course Professor Saw regarding how people are just dominantly living in the urban area. So it also feel like becoming the capital of myopia, secondly after the Singapore. So the average age right now is 32.9 years old, and every day we have more than 3,500 children born. So it's quite young country, and we have 25.2% of the population is under the age of 15 years old. So talking about visual impairment, I've been looking at papers in Vietnam. However, we only have very few papers that have been published talking about the visual impairment prevalence that is powerful enough to be able to present. So this paper was actually done with the support from the Brian Holden Vision Institute in 2014. The data was collected in 2011 in the beautiful city called Bà Rịa Vũng Tàu in Vietnam. One of the beautiful places that you can visit if you have any time. So you can see that the prevalence of visual impairment in that city is in that province is 12.19%. And in that, 0.3% of cases are blind, 0.09% are due to cataract, and 0.05% due to retinal disorders. And then you can see that the higher prevalence of myopia is much higher in the urban area. So we have subsequently, studies that been done in 2021, 2022, that's showing that the myopia prevalence in urban areas can go up to 53.2% and a lot lower in the rural area. So this study also, they look at the risk factors, and one of the risk factors that was top listed were actually the maternal education. So the higher standard the mother has go for the education, the higher chance that your child is having myopia. So that was what is concluded from our study, from our Vietnamese study that done over the past 10 years in Vietnam. And parental spectacle use, aka the refractive errors. So we already know this. Parents having myopia increase the risk of myopia in the child. New work, as many other Southeast Asia or East Asia, we have a very strong education stress. So that because of that, students read a lot and having a lot of reading habit that cause a lot of problem with the myopia. At urban locality, you can see that the more they stay at the local area, the urban area, the worse their myopia can be. And of course, higher grade level, as we know, once the child have myopia, they start growing. So then, the prevalence of myopia start increasing later on. So you can see that here I put the two strongest paper together to show that in 2014 in a very beautiful city nearby the beach, you can see that the urban area, they have only 26.6% of children having myopia. And then in the urban area, in the years of 2021, when they did it in 3 different other locations, this number double. And then you can see also myopia prevalence depending on age and gender. So in age, the higher the age, the more patients have myopia. And of course, genders, we have more female students have more myopia compared to male. And this, I think, is very correlated with many studies that we already are aware. So now we know younger the kids have myopia, female parents have myopia, or other known risks. And we found a similar picture in Vietnam. So what I'm here today to talk about the children eye health in Vietnam. So we have something called the Vietnam National Prevention of Blindness Strategic Plan. This plan was to aim until 2020 and have the insight to 2030. So in that, our government already identified refractive errors as among the key areas to be addressed to reduce the burden of avoidable blindness throughout the country. However, the eye health in children has not been officially included in the school health curriculum. And in Vietnam, children health is systematically evaluated through the Joint Circular Regulation for School Health Service. However, when they come to the eye health check, they only do visual acuity. And as we have just listened to Dr. Rebecca's presentation, you can see that visual acuity alone cannot tell you whether the child functioning well or not. And of course, we will be missing out on the data of the hyperopia on that cases. And currently, eye health, and then because of that, we thought that maybe we can do a little bit better in that. So Hanoi Medical University is now one of the only 2 schools of optometry in Vietnam that offering optometry. We started the program in 2015, and so far we have 450, and this June is going to be 500 optometrists, serving the population of 100 million people in Vietnam. Of course, you can ask what happened with the eye health system in Vietnam. We have another 2,500 ophthalmologists and a couple of thousand refractionists supporting us. However, there's been a big gap in between, ophthalmologists and the refractionists and nurses in Vietnam. So the objective of this program was to have the early detection and intervention for the kids, as well as have the community engagement, increase the awareness for the patients, for the parents and teachers. And then after that, utilizing this collected data to inform health policy and advocate for improved eye care strategy in Hanoi first, and then subsequently in the whole Vietnam. So we run subsequently many screening in Hanoi, the years 2022, 2024. Why? Is because we have COVID during the past, before that for a few years. So then we start doing that again, and we start collecting on data. So I'm going to give you a little bit of insight on that at this moment. However, there's about to have the systematic review published soon by one of our colleagues that's doing her PhD in UK. So in this, you can see that 29.9% of our students in one school was having refractive errors. And if you look at the whole school, every 4 kids, we have 1 kid that have myopia. So that is in primary school of the urban area. And when you look at Hanoi continuously, we have done the other school. And in this kind of health eye examination, we do not stop at the visual acuity testing. We do all of the comprehensive eye examination for these patients. But for this purpose of presentation, I will stop at the prevalence of the refractive errors at the moment. So you can see in the secondary school of the same urban area, the numbers have jumped up from 65 to now 83 of the children. So we continue to do it in another high school, but high school in the center of Hanoi, they are very busy with their education training. So usually they will refuse to have the screening that with cycloplegic. So that would be one of the key problem in Vietnam, that we cannot cycloplegic everyone for the screening purpose. After that, we did one suburban high school. And then you can see that in the suburban area, this number is not too high, but still very much higher than the number that been published by our whole nation information. So 63.5% of our children in high school have refractive errors, and 58% are having myopia problem. And you can see the number of eye diseases are there, but not too high. And one of the problems that we found in our patient who wearing glasses and who are having a refractive errors is the rate of incorrect prescription glasses use. So this, because I'm not sure whether it's Indian having the same problem, but Vietnamese children usually used to have a lot of accommodation spasm. And then they just use autorefractors, at many optical shops. And then because of that, we've been prescribing wrongly glasses for many of the children. And then one of our recent publication by the Ministry of Health showing that the rate of incorrect glasses nationwide was 65%. So that raised a very big questions about how we're gonna treat this patient correctly if you not be able to prescribe a good pair of glasses for patients. So in overview, you can see that children in Vietnam show variable burden of refractive errors and vision impairment, and myopia is the most frequent report conditions, and high myopia rate in urban area can go up to 40, 53, and we can see right now in certain schools it can go up to 80% of the children. And then we have lower myopia rate in rural area that was explained. Maybe we should change, the environment, behavioral, like Professor Saul suggests at the beginning. However, every parents would push the children to study so hard this day. And you also can see that the study has shown the number has increasing, and the rate of children not wearing correct prescription glasses in Vietnam is still very high. So then my last slide would be, what can we do to improve this? So I listened to Dr. James and I realized that we need a lot to learn from everyone. First of all, we need more screening, like more thorough screening with a very good quality screening as well. So we need a protocol, a guideline that everyone stick to that guideline and follow it. And then we also need a better refraction service team. Because right now in Vietnam, if you are going to any kind of the glasses optical shop and then you get wrongly prescribed spectacles, that's going to be a waste of time and increase the awareness of the public. I'm a myopia management person. I love to do myopia management, but one of the concerns that I always get is when my child get worse if they continue to wear glasses, and they just want to go glasses free all the time. So then, if we can increase the awareness of the public all about, hey, wearing glasses is not that crazy. And I know we've been talking about atropine, we've been talking about stylus dims and all of the fancy equipment, talking autokeratology, soft contact lenses, but come on, there are children that have visual impairment due to uncorrected refractive errors. So my last talk, so I hope that it's not take up so much of your time. It's my pleasure to be here today, and thank you so much for your listening. Yeah.
Sorry, that was a fantastic talk, Minh, and I've got a couple of questions. Is there anyone in the audience who would like to ask questions?
Dr. Minh, thank you for that wonderful presentation. Yeah, the percentage of refractive errors, what you have shown us, is it typical for your country, or is it the same in the other Southeast Asian countries as well?
So I think one of the difference in Vietnam and many other countries in surrounding area is also the urban locations. So you can see that from Singapore, as Professor Saul speak at the beginning of the talk, the number of refractive errors, especially myopia, is much higher in those countries. So this prevalence is applicable only for Vietnam at the moment. Yeah.
And one more question. In the slides which you have shown us, the percentage of myopic astigmatism is more combined with the myopia and hypermetropia. In the last few years of my clinical practice, even I have the same findings, but I couldn't document it. Is there a shift of refractive errors from myopic to astigmatism?
I don't think there's a shift in myopic into myopic astigmatism, but I think that there's a collected data to talk about astigmatism. And one of the clinical findings that I found normally is the child usually wear higher prescription, like they adapt to the astigmatism power and require a little bit higher over time, but it isn't the progression of astigmatism. It's just something that they didn't wear at the beginning, but then they eventually need when they increase demand for reading. Yeah, so that's what I found. I think there's an report data on the astigmatism power.
Is there any guidelines from the government to combat this surge in myopia from your side?
sorry, compare.
Is there any guidelines from the government sector to combat this increase in myopia apart from the reduced screen time and like outdoor activities?
Not at the moment for us. Yep.
Thank you.
Thank you for an excellent presentation. One thing, it's sort of more a comment, I didn't point it out closely in my presentation because there was too much data, but in the Sydney myopia study, when they looked at refractive correction in 12-year-olds in an urban population in Australia, they found 17% of the children wearing glasses didn't have refractive error. They were wearing extremely low plus glasses for perceived reading difficulties or concentration difficulties and things like that. So it's interesting, there's a balance between, as you point out, a huge number of children in your country that have uncorrected refractive error, but when refractive correction becomes readily available, you can get a tip of the slide going the other way, and children apparently needlessly wearing glasses. You know, the reasons behind it are probably complex, but it was a very interesting and difficult to explain observation in that study, that in an affluent country you have a significant number of children wearing glasses for non-ocular reasons.
That's a fantastic, point Dr. Elder discussed about. And thinking about it, I can recall an instant where, we went to, 17% of children who had glasses really did not need them. But on the other hand, one of the vulnerable groups that's been, people don't usually talk about it is special schools where children with special needs, they study, When we did the refractive error screening, and we found about 70% of these children had refractive error, only 4% had spectacle, correction. So there is sort of imbalance. We readily, provide care for children who are, in the mainstream schools, but whereas in the children who are in special schools are ignored. And coming back to you, I just have a question. You presented, the prevalence data on vision impairment and refractive error. I was just curious to know, are there any information on the eye care workforce to provide pediatric eye care for children in Vietnam?
Yeah, so the primary eye care workforce for children in Vietnam at the moment, including pediatric ophthalmologists and refraction, I'm not sure whether quantum refractionists / ophthalmic nurses. I've been trying my best, and of course along with all of the institutions in Vietnam as well as NGOs to kind of providing the optometrists. But so far we only have 450, about to go up to 550 this July when we graduate them. Then this number is still very tiny little for becoming the main source for providing eye care system. So we have 2,500 ophthalmologists and I think couple of up to 7,000 opticians. However, you can see the quality is very not very competent at the moment. We're trying our best to improve that and hopefully be able to present you with much promising data in the next few years.